Unmesh Srivastava, welcome to the Human Capital Innovations Podcast.
Thank you, John.
It is a pleasure
to be here.
Thank you. It's a pleasure to have you. You're joining us from California. I'm south of Salt Lake City in Utah. And today we're going to be talking about healthcare and organizations, which is always an important and challenging topic. Anyone who deals with total compensation and benefits within an organizational setting, such as HR managers, are constantly frustrated with the rising costs and the challenges around that. Today, specifically, we're going to be talking about the basics of healthcare innovation in large and small scale organizations and try to tease out what we might be able to do as organizational leaders to make the best of a messy situation, to provide good benefits for our people. As we get started, I wanted to share Unmesh's bio with everybody. Unmesh is Chief Digital and Technology Officer at Clever Care Health Plan. Over the years, Unmesh and his team have helped U.S. healthcare with opportunities to drive innovation and distribute transformational. I'm going to say that again. Over the years, Unmesh and his team have helped U.S. healthcare with opportunities to drive innovation and disrupt transformation using digital enablement. He has worked with multiple innovation organizations, building and deploying the next generation of healthcare. All the digital enablement projects have been geared towards driving his differentiation, provider, and patient experience while reducing the cost of care and improving quality of care. The technology products delivered by Unmesh and his teams range from clinical decision support technology for providers, data and artificial intelligence enabled seamless care experience for patients, and multiple other innovations to drive down the administrative burden on the providers and health systems. That is fantastic. And like you said, being able to have a greater level of experience while driving down cost and improving quality of care. I think that's ultimately what everyone would love to have. And that's the real challenge. Anything else you would like to share with listeners by way of your background or personal context before we really dive on into the conversation?
No, I think you covered it all. I've been in digital health for close to 15 years and have worked with large and small organizations right now at Clever Care Health Plan. And, prior to Clever Care, I was with P3 Health Partners, which when I started there was a small, we were serving 5,000 lives. We went public in 3.5 years. Prior to that, I was with United Health Group, Optum, and I worked with Kaiser Permanente as well. So worked with various large and small organizations. I can tell you there's no dearth of need of innovation and transformation in healthcare for sure.
Yeah, absolutely. And of course, these last couple of years have just added, the complexity and the challenges related to healthcare and meeting the needs and the health needs of employees within organizations. So perhaps we'll touch on that a bit as well. I already mentioned in your bio just some of the types of innovations that you and your team are a part of, but maybe you can flesh that out for us a little bit. What do you see as kind of the current state of the innovation landscape in healthcare? And then maybe we can talk specifically about some of those innovations that you're driving.
Sure. Yeah. So, in terms of most of the work that I've done along with, of course, my teams, it's primarily geared around, impacting the quadruple goal of healthcare, reducing the administrative cost or medical cost, improving patient experience, improving provider experience, and, improving overall quality of care. Right. So from a technology perspective, there's multiple things going on. There's multitude of problems that exist today, which I've been involved in working, and I think there's still a lot to cover. Starting from data analytics, there's, as everyone knows, interoperability is still in very nascent stages in healthcare. We still deal with a lot of faxes and paper in healthcare. So getting data from multiple sources, combining that and building a strong data environment to really talk about total patient 360 views and things like that, right? There's a ton of work that is going in the data and analytics space and interoperability space in healthcare. There's a ton of work which is going on in the workflow orchestration within healthcare settings. As you know, when EMRs were brought into the healthcare system, they were supposed to make physicians' lives easier. It just happened that it went right opposite of that, right? And it became just such a big administrative burden on the providers that that they have to spend so much time of their day just documenting in the EMRs from a documentation compliance perspective. So ton of work going on and just simplifying their day-to-day workflows to reduce the burnout and the time they spend on systems as opposed to talking to their patients and solving for their healthcare needs. There's a bunch of work going on in the artificial intelligence, machine learning space. Clinical decision support, especially like there are a couple of things in AI and ML space. We get so much unstructured data today in healthcare, using quite a bit of NLP technology to convert a lot of that unstructured data to structured or extracting critical intelligence from that unstructured charts and PDFs and paper to really, not lose those nuggets of wisdom within a patient chart. So bunch of work in NLP, bunch of work in, there's quite a bit of work going on in machine learning, deep learning space. We're doing clinical decision support, suspecting conditions, medical conditions, identifying disease progression, multiple things there. Social determinants with what we are doing at Clever Care Health Plan. A lot of what we are doing is really, we are a Medicare Advantage plan. So we are serving Medicare Advantage members who cannot speak, whose English is not their first language. So they're not able to interact with their healthcare system. So there's a lot of like culture and social determinants that we are trying to bring central into senior care with Clever Care Health Plan. A lot of work, I think these days, like social determinants is a big area which has to, a lot of healthcare folks are trying to bring it mainstream and include that within the clinical care reams, right? So a lot of work. So, I mean, if I start talking, there's so much work going on. All around in healthcare, privacy, compliance, cybersecurity has so much stuff going on, so many data breaches. So, a lot of work going on in that space. So yeah, there's endless work and a lot of innovation in healthcare right now, especially related to digital data and tech.
Yeah, which is fantastic. It's so needed, again, to reduce costs, increase quality of care, increase the patient experience, and on the organizational side, on the healthcare system side, to be able to ease the strains, right, and the challenges that they're facing. That's really going to create, the best outcome for everybody. And so leaning into the digital transformation, the technological disruptions and innovations, all is going to be super important as we continue to move forward, just like in healthcare, just like it is anywhere else, in any other form of business. So I'm wondering now from the organizational side, meaning, my organization, I'm an employer. I have 1,000 employees. We have a healthcare benefit that we provide to our employees. And I'm trying to think through with my HR team, what type of healthcare benefits we want to have and how to keep those costs in check. Given the landscape of these innovations that are happening, any suggestions or advice for organizational leaders as they're trying to think through and navigate the types of plans, the types of systems, the types of organizations they should be partnering with?
Absolutely. No, I think that's a great point. If you go back to like the very basics or ethos of healthcare, right? I think everyone knows if you are engaged in your healthcare preventatively, proactively, that will not lead to chronic conditions or will not lead to sudden events, because there will be a lot of predictability that you'll be able to build. And there will still be some one-off scenarios that you cannot, walk away from. But generally, I think as folks who are working, at least for me, I've been working with Medicare, Medicaid, populations mostly in my career. And big part of the whole thing is like, hey, can you empower primary care? Can you ease access? Can you engage members or folks at large in their healthcare? So that will lead to reduction in, emergency room admissions, will reduce, these unidentified events in care, or even like chronic conditions, right? So ideally, like when you think about that, you want to find you at least the two pillars that I see from my perspective is, one, you want to build a network or have a network of primary care and a preventative medicine, anything that surrounds primary care, so that your employees can engage with that, those providers. And two is really lay a lot of emphasis on access and engagement, right? Access in a sense, when you have these primary care providers, how easily they're accessed by your employees, by telehealth, by using telehealth, if there are folks who have chronic conditions like diabetes, CKD, CHF, COPD, having some level of like wearable type program that you can provide to them through which you can track their vitals remotely and then provide them with care as and when needed. And then I think that's really from the network and access side. You want to improvise access. And two is you want to increase their engagement in their care, right? So things like, partnering with vendors. There's so many vendors out there today, which will, part of the insurance plan can build engagement programs like, hey, Heart Walk, or, folks where you can build challenges for employees on whoever is going to walk the most for that particular month is going to be rewarded, right? So I think there are subtle ways to really engage populations at large, and then really identifying the ones who are not engaged, because there will always be populations who are not engaged, and then have a strategy around that of how you can give them a more concierge, outreach focused care as opposed to them coming to the healthcare system. So I think if you start with that as the ethos of your benefit packages, and that's how you work with whichever insurance or brokers you're working with to design your insurance, I think you should be fine.
Yeah, I like the holistic wellness kind of approach that you're suggesting. I think that's so very important. In the preventative care piece, if we want to keep costs low, preventative care is the way to do it. And ironically, so many organizations, I see this a lot, that because of the rising cost of healthcare, they want to provide something for their employees, but they don't want their employees to have to pay too much out of pocket. The organization doesn't feel like they can pay too much out of pocket. So then you end up with a really crummy high deductible plan that doesn't actually do very much. It certainly doesn't help with all the preventative stuff that you're talking about. It's really only there for catastrophe. And, that's better than nothing, but it's not much better than nothing. And it's not going to do anything to actually, within the system, as you're talking about, to drive down costs, because we're not dealing with preventative care. People are only going to be getting care as they have emergencies, as they have catastrophes, rather than just maintaining their overall wellness over time. So I don't know, that's the big conundrum, right? Is any thoughts on how we deal with that tension, recognizing that organizations don't have an endless amount of funds to put towards the healthcare for their people, especially smaller businesses who may be really struggling to make payroll. How do we balance that? Because man, that just seems like such a difficult, almost completely untenable kind of a challenge.
That's right. And I think part of the calculation here, John, has to include the soft benefits of having. I'd rather pay a little bit more as an employer on the insurance and getting the right plans built for my employees, because it's not really just their healthcare. Like, in this day and age, there's so much attrition. There's so many people who are leaving your organization. And a lot of that really talks about it's as much as you can say there are better opportunities. I think it's also the employer. So I think as employers, we really need to shift our mindset. And, we have employees, we are a startup, around 125, 130 people working with us. The way, at least I can tell you, I see this is I also look at the soft benefits of this, right? Employee longevity. How positive are they going to show up at the work environment and the productivity that they are going to produce at the end of the day? What's their happiness index working with you, right? So a lot of this, I think, if you do not provide the right benefits in general, not just healthcare benefits, there are other things involved: flexibility, work flexibility, career path, all of that. Like, employers have to think about that holistically, because culture, this sort of impacts your culture directly, and culture eats everything else, your strategy, your market, your clients. If your internal culture is not good, it will lead to repercussions which you cannot put on paper and pen. So my take is, like, as employers, when you're designing this, your cost benefit, I think that the benefits are more than just, what you can figure out in your P&L related to your medical costs. I think it's much more. And personally, for me, as an employer, even as a small business, I'd rather spend a little bit more money to provide the right insurance and the right, just overall, like, my offering to my people, so they stay with me for a longer term, and they have good productivity, and they enjoy working with the organization. I'd rather not hire 10 people. I'd rather hire 7 with very high productivity who are happy, as opposed to 10, but then those 7, I really take care of their health, their emotional well-being, their physical well-being, and everything that relates to them.
I love it. Yeah, you sound like the type of employer I would want to work for. That's fantastic. I love the mentality. And again, part of what I hear you saying is it's kind of this tension between short-term versus long-term perspective and strategy around our people. And when I see things like high deductible plans, what I see is, and I recognize it, and I feel for leaders who are struggling in this space to try to provide something for their employees, but feeling like they can't provide as much as they want. So I get it. I get why these high deductible plans are used. I get why they're given as an option so their employees can use them. But ultimately, that's really kind of more of a short-term perspective, isn't it? Because you may have short-term cost savings in terms of the medical plan, but long-term in terms of burnout, chronic health issues, engagement, satisfaction, innovation, all those things that in many cases, the intangibles of just having a really great team, all of that is going to go down, and the costs associated with that is tremendous. And so I agree. I think just really making sure that we're investing upfront in our people, and investment in our people includes a lot of facets, but meaningful holistic healthcare and wellness is one of those really key components that I think has to be there. So if we can focus on that, recognize, yes, it's going to cost a little bit more, but if we have a holistic plan in place, over time, we can work to reduce those costs. And just because we'll have more healthy people generally, because they're getting their needs taken care of as they arise and in preventative ways. And then in the long term, you can reap all sorts of extra benefits because of lower turnover costs, greater retention, better team camaraderie, stronger culture, all of those things that you mentioned. I think that's fantastic. Well, I know at the time we're getting close to the end of our time, but I thought we can end today with you just sharing with us your thoughts on, say, the next 5 years of healthcare innovations. What do you see coming down the pipeline, both within your firm, but also just out there generally, that we have to look forward to in the healthcare space?
Well, yeah, there's ton of work going on in healthcare. I think this decade will really be a game changer in healthcare because of all the work which is going on. Some of the things that I see which are becoming more mainstream these days. I think genomics is really gonna become mainstream and democratized in terms of costs. Right now, it's too expensive for a regular person to get to and be included in your insurance benefit packages. But I think genomics is the way to go to really do early disease prediction, to really identify, disease progression and so forth in individuals. So I think there's really going to be, that's going to be democratized. Healthcare will be continuous and seamlessly accessible, as you could see from pandemic, and all the work which is going on in the IoT space, wearable space. There's a lot of movement there. I don't know if you've seen like Apple Health and how they've connected to network of all the inpatient providers and labs. And, you can right now, if you create your medical ID and you go to organizations who are currently, part of that network, you can easily access your, like I was doing my regular checkup, yearly checkup last week. Within 2 days, I had my results on my phone because LabCorp was connected with my Apple Health. So there's a lot of movement on healthcare data sharing, and healthcare is going to be continuous. It's going to be very easily accessible with telehealth, with virtual care, so much impact on virtual care. I think the third area I'm seeing a lot of work going on and is social determinants is going to get mainstream and big part of clinical care delivery, because a lot of what's going on the social determinant side has a direct impact on clinical, on person's health. So a lot of health systems now are realizing that and including social determinants of health benefits within the benefit packages. So you do get access to like social workers, you do get access to transportation, to food and so forth, which will lead to reduction in healthcare costs. So I think there's a lot of movement there. Mental health and behavioral health, this is a fourth one. There's a lot of emphasis on mental and behavioral health, especially after pandemic. I think it's become mainstream because people are isolated. This has been, I think, mental health. You see, like, I just see this as a root cause of a lot of issues, clinical issues, a lot of societal issues are led with, are coming out of mental health issues in individuals. So I think there's a lot of work going on there. In terms of comorbidities or conditions, cancer care, there's a lot of work going on in, finding the right cancer drugs, which can really, with a combination of genomics, can really, you can identify that before it happens and then make sure you do, you kill it before cancer happens. So a lot of work on immunotherapy and gene therapy in cancer care. Yeah, I mean, these are some of the things. There's just, John, as I know you know healthcare, you've been in healthcare, there's just a lot of work going on. And I'm very hopeful for the future of healthcare. As much as I see the trends that the healthcare costs are not going down, and they're only going up, but there's all of this work going on. Hopefully with all this innovations and, grassroots level changes, we can untangle healthcare in the next 10 years, because it's really required. Right now, where we sit, there's a lot of work to be done.
Yeah, I agree. I'm hopeful, cautiously optimistic, but I recognize the complexities and how hard this is going to be. It's a heavy lift, but there's lots of good people doing lots of great work, and you and your team are on that list. So I really appreciate what you're doing. It has been a pleasure talking with you today, Unmesh. As we wrap up, I just wanted to give you a chance to share with listeners how they can connect with you, find out more about your work, your team, and then give us a final word on the topic for today.
Absolutely. Yeah, I'm all about giving back and helping people. If I can answer if you're trying to get into healthcare technology, want to reach out in general, LinkedIn is the best way to do that. So reach out to me on LinkedIn. Not very good at responding to sales pitches because I get so much, it gets overwhelmed with that. But if you want to reach out on LinkedIn with any general questions and advice or just general discussion, very available there. Shoot me a message. I think, Clever Care, what we are doing is really path breaking because there's so much going on in healthcare equity. So if you have, seniors in your house, Medicare, folks who are with Medicare Advantage and they do not speak English as their first language and are looking for a plan which can provide them with more preventative care benefits, check out Clever Care and sign up, because I think what we are doing there is really patient-centered and built for folks who cannot engage in their healthcare system because of language and cultural barriers. Final word, I'd say like this, I'm hopeful. I'm glad that we are talking here, John, because you're taking the word out of a lot of organizations who are performing the innovations and doing what they're doing and taking the word out and distributing it and letting the people know so they can have access to this. So more power to you and what you're doing. And I think if there's for folks listening to the podcast, if you want to reach out regarding healthcare, tech, digital, reach out to me on LinkedIn and we'll talk.
Wonderful. Thank you, Unmesh. It has been a pleasure. I encourage listeners to reach out, get connected, find out more about what Unmesh and his team can do for you. And as always, I hope everyone can stay healthy and safe, that you can find meaning and purpose at work each and every day. And I hope you all have a great week.